We appreciate the opportunity to be here to talk a little bit about the American Rescue Plan Act funds that our local governments received. We have a whole lot to talk about, but we're gonna do it in a time limit. 3 or 4 major points that I think you want to take away from your understanding of the act. One, we're extremely grateful that the federal government decided to do a one-time appropriation for all 19,000 cities, towns, villages, boroughs throughout the entire country, along with every county. We haven't seen anything like that before, and that will help our cities and counties. But the second major point I think we want to make is that this is not a panacea. This doesn't fix lingering policy issues. These are one-time funds that won't be reoccurring. And that issue will keep coming up, I think, as we go along when we talk about how this money can be spent with the constraints that the federal government and the U.S. Department of Treasury has put on cities and counties in the expenditure of the funds. This is a lot different than the CARES Act funding. That was a reimbursement basis type of program. This is an appropriation. We're not in a rush here to meet a looming deadline. When we were trying to get CARES funding, we had to make application by December 31st or December 30th, 2020. That ended up being extended, and so there was a rush, and local officials were rushed to try to get their reimbursements in and expenses in so they could get the reimbursement. With this act, we have until December 31st, 2024 to spend or obligate. If we obligate it prior to December 31st, 2024, this funding, we have until into 2026 to make the expenditures. So this can be this should be a very deliberative process with the local governments on how they spend their allocation. They have time to engage their constituency. They have time to collaborate with other cities in the county, their county governments. And those are all things that you'll see. I won't speak for Jim, but you'll see KLC, KCO, I guess I will speak for you, KLC, KCO, the ad districts, the Department for Local Government, and those that advise and counsel our cities and counties to take their time, because this is going to be an evolving process. We have a lot of unanswered questions from the United States Department of Treasury. They're updating their FAQs, their interim final rule as we go along. So this will be a training process that will have to continue. To that extent, we've all created web resource links for local officials so they can see updated information. Ad districts and others are putting on training sessions so local officials can understand all of these constraints. And then I'll do this PowerPoint, but those are the 3 major points I think we want to make. For city governments in particular, ours is going to look a little different than what Jim's going to explain with county governments. We have 9 cities in Kentucky that qualify as metropolitan cities or entitlement communities that generally get their CDBG appropriations directly from the federal government. 9 of those in Kentucky, and those include the obvious, Lexington, Louisville, but Elizabethtown, Owensboro, Bowling Green, Henderson are all on that list of getting Hopkinsville, Representative Walker, are all on that list of getting direct appropriations from the United States Department of Treasury, much like the county governments, and I'll let Jim explain that group. Then we have another subset, about 405 cities in Kentucky are non-entitlement cities. And that money is going to flow through the Department for Local Government. It's again different than the CARES Act, where we had to make reimbursement requests. It's functioning more, I think DLG would agree, to call it more of a flow-through basis. And that's what Congress directed the states to do. I think the governor's designated the Department for Local Government to flow that money through. They have some administrative responsibilities in doing that. They have to ensure the city's allotment of these 405 cities is not greater than 75% of its previous budget. That's probably going to hit 10 to 15 cities where they got an allotment bigger than 75% of their budget. That's the amount of money we're talking about. So they got to certify that. They got to ensure compliance with the executed agreements, Title VI compliance, and other documents. So that's in process, and I'll commend the Department for Local Government, Billy Johnson, Matt Stevens, and their staff over there have done an excellent job of communicating with the 405 other cities besides those entitlement communities in getting that out. If you look at the total awards, 607 to the big cities, to the entitlement communities, 607 million, 324 million available for the 405 non-entitlement cities. In your packet, I believe you have an estimate and breakdown of what every city in Kentucky will receive under this agreement. Now, the non-entitlement communities are population-based, whereas the entitlement communities was based on the formula related to CDBG that takes into account income and other factors besides population. So a lot of people look at that list immediately when we sent out the estimates. The folks from Owensboro, Representative Johnson, called and said, how in the world is Covington getting twice as much money as Owensboro? And that entitlement formula with CDBG is not purely based on population. So that explains some of those discrepancies. 6 major areas of utilization. And again, let me emphasize, this is ongoing process where we get more guidance from Treasury. And I think the longer communities wait, the more precise that guidance will be from Treasury. I know air phones are blowing up, and I think Keiko can testify to that as well, that we're getting calls. Can we do it to buy the backhoe to dig the sewer line? Can we use it for this or that purpose? And until the guidance gets a little more substantive, a little more meat on the bones, I think you're going to see a real cautious approach to the expenditure of these funds. They don't want to mess around with having the federal government claw back any of these funds. So more particular guidance is needed. Just briefly on these 6 major categories, supporting the public health response is the first category designated for the expenditure of the funds, and that can be used. It looks more similar to what the CARES Act did on any broad range of public health needs. That includes medical expenses on both medical and behavioral health, including substance misuse, payroll for essential workers. That's going to be a little more difficult because it has to be spent March 3rd going forward on essential workers for their work and mitigating the impact of COVID. Well, we're coming out of this pandemic, so I don't think that's going to be a highly utilized area. But vaccine, public relations, public communications effort, tracing. Also, one we're getting a lot of questions on under this category is capital investments in public facilities to meet pandemic operational needs and ventilation improvements. So that one, that's probably going to be the most utilized area rather than seeing the payroll like you did under the CARES Act. Second broad category was addressing the negative economic impacts of the health emergency. That's unemployment aid, household assistance such as food, rent, burial assistance, cash aid. We've gotten that question a lot from city officials. Can we give a local stimulus check? And the answer under the guidance is yes, as long as it's in proportion to the harm experienced with the pandemic. The guidance spends quite a bit of time talking about the ailing businesses that are involved in tourism and hospitality, rehiring public staff to their pre-pandemic levels, completion of any planned expansion of tourism projects that were delayed due to the pandemic, all fall under that category broadly. Then the third area is targeting low-income communities. This is a priority of the Washington administration, I believe, to hit qualified census tracts. If a population or geographic area has been disproportionately impacted as a result of the pandemic, they can do community health, homelessness assistance, affordable housing, early learning, child care investments in those disproportionately impacted communities. And then fourth category would be the recoupment of lost revenue. This sounds really good, that if a city or county lost a bunch of money as a result of the pandemic, then we'd be able to capture that revenue and plow it back into the general fund and spend it. Treasury's guidance has made this process a little complicated, and there are some issues with that. You have to calculate at 4 points in time what your losses of revenue are. You can assume a growth rate of 4.1%, which is going to be good for some Kentucky cities and counties using the national average. Or the greater, if it's greater, looking at the growth in the budget from fiscal year 17, 18, and 19, the 3 years immediately preceding the pandemic, and use that as your multiplier factor. If a city does that calculation on December 31st, they can do it immediately for December 31st, 2020. They'll do it again in 2021, 2022, and 2023. If that mathematical formula shows that there's a drop or decline in revenue, there's an assumption that anything less was pandemic related. They can capture that revenue and put that directly into any governmental service. It is the least restrictive mechanism for collecting that revenue and spending these funds, but it has some shortfalls. If a city or county raised their taxes during the pandemic or exhausted their surplus funds, this money won't account for a tax increase. It won't account for any depletion of rainy day funds as a result of that. The fifth major category, premium pay for essential workers. This is one area where the Treasury has encouraged a retroactive look back. It's one that I think that cities are looking at pretty hard before they dive into this because, again, emphasizing the fact that it's one-time money, but it authorizes you to pay essential workers, which are all your public safety, community health workers, nursing home workers, grocery workers. But for the city government employees or county government employees, mainly it's going to encompass public safety, some sanitation workers, and it allows you to do up to $13 an hour, up to $25,000 per employee to do pay for essential workers. It allows the CEO of a city or county to designate other essential workers beyond that which is listed in the Treasury interim final rule as well. There are some limitations on that. It's one-time money. It allows you to look backwards. I think we're going to have to get a lot of additional guidance on that to get some comfort level, at least with city leaders that I've talked to this point, about using it there. And then the sixth major category really doesn't touch on related to the pandemic as much as the first five do, and that is to make direct investments in sewer, water, and broadband infrastructure. And those are pretty broad. For water, it allows for use of projects, pandemic-related or not, anything consistent with the the federal Drinking Water State Revolving Fund. For sewer, the Federal Clean Water State Recovery Revolving Fund, which includes the construction, treatment, transmission, distribution. For sewer, it allows stormwater work. And then for broadband, it encourages the use of these local funds to extend out to unserved or underserved areas in the community as well. And there's some limitations on that, and I won't take up budget director's discussion on the use of what you all did as a General Assembly. It is very clear under this act that you cannot use these funds. A city or county cannot use these funds to shore up any unfunded liability in a pension plan. That does not, a lot of local governments have legacy pension plans, but that does not forbid them from using normal employer contributions for payroll if they do any of these payroll extensions or premium pay as well. You can't pay off outstanding debt that existed pre-pandemic. That's forbidden use explicitly under the Act. You can't settle that pesky lawsuit to do legal settlements or pay any judgments on a lawsuit. You can't use it for financing expenses for the incurrence of new debt or to replenish a depleted rainy day fund. And then the money cannot be used. Cities and counties won't be able to use the money for matching any non-federal match requirements. And that's going to work differently with the money that you all appropriated, and Budget Director Hicks, I believe, will cover that. that's not considered a federal grant program. So this money could be used in conjunction with the money that you all appropriated last session before you all adjourned. And the challenges related to these things that we're waiting on, the formula looks at only general revenues. It includes all taxes, rental, concessions fees, things of that nature, but it doesn't look at lost utility fees. So we can't calculate that in lost revenue, and that was a big deal for us, as Representative Bray knows, during the pandemic. The formula will penalize cities or counties both here that raise their taxes, that took action to deplete their rainy day funds or to otherwise raise their revenue because that will not be included in the revenue shortfall. We're making these points during this opening period with the Department of Treasury through our national associations as well, but we're directly doing that for Kentucky cities to say, here's how this is working and impacting us there. And some other issues are the utility thing that we pointed out before. This isn't going to be able to pave roads or streets unless you capture some of that lost revenue. It doesn't address that transportation. We got water, sewer, and broadband. Only if you capture lost revenue are you going to be able to use it for any general governmental service, which could be to pay a public safety salary or do some minor streets and road work in your community. But it's not a specific allocation either. The reporting requirements are not entirely clear. This is a look-forward basis from March 3rd, 2021, and a lot of the expenditures that are permitted are really tied to pandemic-related at a time when we're coming out of the pandemic. So these limitations are going to be pretty difficult until a lot of these issues are addressed. And then the issue with the documentation and reporting, I think DLG will tell you we're waiting patiently for Treasury to give us some additional examples of how and put more meat on the bones of the rules and the FAQs so we can determine how we're going to have to report, because everything in this act tells you have to show how there was a disproportionate impact, how it was tied to COVID. So how we're going to prove many of these things in our federal reporting. Our reporting goes directly back to the Department of Treasury. We're waiting on those, so it leaves a lot of open questions going forward. 38 comments, questions Treasury asked in its proposed rule that they ask cities and counties to answer, so we know it's going to look a lot different as it goes through the process. We have till July 16th to get those comments in. We have a lot of questions that haven't been answered. So I think over the course of the next 3.5 years, I think it's safe to say, which is our deadline for at least obligating these funds, there's going to be a whole lot of educational effort and a whole lot of change from what we know today based on the Treasury guidance.